Welcome friends. We discuss about integrative modalities of treatment for headache. We insist you to get the types of headache evaluated from your concerned physician or neurologist and then try our evidence-based integrative modalities of treatment. So based on various available integrative modalities of treatment, we have chosen few. They are acupuncture, biofeedback therapies, manipulation therapies, massage therapies, mind-body therapies like biofeedback, mindfulness training, mindfulness breathing techniques, and mind imagery techniques. This will help you mainly for the people with headache which are mainly caused by stressors or tension. Tension type of headache, cluster headaches and few other headaches will be more beneficial with these therapies. What we designed, all these therapies are based on our vast experience in this field of integrative medicine, integrative neurology for more than a decade, and we assure the best of evidence-based therapies for you. So when we discuss about acupuncture, acupuncture is a principle based on the traditional Chinese medicine system where they believe that there is a flow of energy or qi in our system, and if you manipulate that particular qi with either acupressure, acupuncture or moxie or electrical needle stimulation, it can modulate the pain sensations and reduce the intensity of headache. Maybe it will work by producing enough endorphins, like few of the research says that, and some of them changes the pain perception. Some deeper pain, you perceive a superficial pain where there is a stimulation of nociceptive stimulus or C fibers, subcutaneous C fibers, and you forget, the brain forgets the deeper pain. So various mechanisms, some of them proven, some of them yet to. So we use as evidence-based practices as possible in acupuncture. So next one is breathing technique. If the headache is related to mainly tension type of headache, migraine headache or other forms of somatic headaches, you get maximum benefit if you work on the regular pattern of breathing. Say for example, when you are stressed, anxious or angry, your breathing will become short, irregular and erratic. So there is a sympathetic dominance in that. So sympathetic dominance increases the breathing frequency and irregularity of breathing. So correction of that irregularity can help you to stimulate the parasympathetic nervous system, and by that the muscle tension can be reduced and the intensity of headache can be relieved or alleviated. So regular pattern of breathing, we use our own indigenous innovative technique of 4-4-4 breathing technique or 6-4-6 breathing technique with some of the mudras where it can help you to relieve or defocus your mind from the focus of headache to something neutral. So use something like Shankhamudra and you focus your attention on the blood circulation of that thumb and you do the regular pattern of breathing. By this we claim that your parasympathetic nervous system is stimulated, your relaxation response is set in, and the endothelial release of nitric oxide can cause the magic of relieving your headache. So when you are attending our extended relaxation technique program, you will learn all these techniques. Mind-body techniques like mindfulness breathing, mindfulness meditation or mind imagery technique can be mainly useful for headaches which are like cluster headaches or migraine headaches, tension type of headaches, where the focus of mind can be dissociated or distracted to something else, something neutral, either your breathing or something mind imaginations, where we make the person get their mind dwelled into a system of a series of imagery techniques which are particularly helping you to dissociate your mind and induce a deeper sense of relaxation. By that, the muscle tension can be reduced and headache can be relieved. Some other methods like massage, manipulative therapies, or biofeedback devices are also used. So some biofeedback devices which can be put it on your arm, which can continuously emit certain frequencies where the nociceptive stimulus to the brain can induce a sense of relief from the headaches. So there are some proven techniques, and few gadgets are yet into the market which needs to be proved and approved, and we use some of the gadgets for that. Few other methods like chiropractic or acupressure therapies and some other herbal treatments, Ayurveda treatments are also being used for headache. So we discuss and adopt based on the individual case of your headache, based on the type of headache, based on the frequency of the headache, based on the intensity of your headache. We chose the combination of conventional and complementary therapies. Hope you enjoy our seminar on headache and get the best out of it, so that lifestyle modification can add in relieving your headache completely, or at least to a level that you can sustain the headache much better with minimal medications. Thank you. Very slowly and gently, keep your eyes closed. We are going to practice a relaxation therapy focusing on your headache, which uses the component of reducing your number of thoughts, reducing the frequency of your stimulations, either eyes or ears. You will be closing your eyes and internalizing your sensory inputs. The sensory bombardment will be reduced from the outside world so that you can focus internally, and by that we hope that we can stimulate the relaxation response in the individual, and by that relaxation response we achieve maximum possible relaxation response to the muscles and the body. By that we achieve better headache relief. So you need to practice this relaxation technique frequently, maybe at least 30 days to 40 days every single day for about 10 minutes to 15 minutes per day. It will create a habit in your mind and body system, and it will induce deeper relaxation. Let us begin the practice of special integrated relaxation module, psychosomatic relaxation module focusing on your headache. Very slowly and gently keep your eyes closed. Focus your attention on your breathing. Gentle breathing in and relaxed breathing out. Gentle breathing in and relaxed breathe out. All the external sounds and noises you can avoid by focusing your attention on your breathing. Gentle breathing in and relaxed breathe out. Gentle breathing in and relaxed breathe out. Very slowly and gently focus your attention on the tip of your fingers. We focus on the muscles, on the skin surface, and on the digital blood pulsation. Make a fist of your hand as tight as you can. Hold it for about 5 seconds. 1, 2, 3, 4, 5. Slowly release and relax. Gently drop your hands down. Focus your attention on your arms, both the sides. You can make your arms like this. Hold it tight as possible. 1, 2, 3, 4, 5. Relax, bring it down. Very slowly and gently, the wave of relaxation is spreading over your arm. Then to your shoulders, raise your shoulders up like this towards your ear, elbow straight. Hold it tight for about 5 seconds. 1, 2, 3, 4, 5. Relax. The trapezius muscles are relaxing, shoulder muscles are relaxing, deltoid is relaxing. Very slowly and gently focus your attention on your forehead, frontalis muscles. Raise your eyebrows up. Hold it tight for about 5 seconds. 1, 2, 3, 4, 5. Release and relax. Feel the muscles of your forehead. Those are the muscles, flat muscles of your head, which are involved in your headache. Focus your attention on your eyeballs. Squeeze your eyeballs as tight as you can and hold it for about 5 seconds. 1, 2, 3, 4, 5. Release and relax. Feel the letting go effect around your eyeballs. Very slowly and gently focus your attention on temporomandibular joint. We'll stretch it by doing ah. Make your mouth wide open as this. Hold it for 5 seconds. Very slowly and gently release and relax. Slowly shift your attention to the oral cavity muscles of your mouth. Orbicularis oris. Make your mouth in the form of O. Stretch and hold for 5 seconds and then release. Feel the relaxation around the muscles. Slowly shift your attention towards your tongue. Roll your tongue inside of your mouth, inside of your oral cavity, and hold it for about 5 seconds. Very slowly and gently release and relax. Focus your attention on your neck muscles, platysma. Either you stretch your neck muscles or extend your head backwards like this, so that you can stretch and focus your attention on the platysma muscles, the muscles of your neck. Hold it. 1, 2, 3, 4, 5. Relax. Very slowly and gently focus your attention on your chest. Take a deep breath in and hold your breath for 5 seconds. Exhale and relax. Very slowly and gently keep your both hands onto your tummy. Hold it tight for about 5 seconds. 1, 2, 3, 4, 5. Relax. Very slowly and gently focus your attention on your hip muscles and thigh muscles, quadriceps and gluteus muscles. Squeeze your buttocks and tighten your quadricep muscles as tight as you can in a sitting posture. Tight it, hold it. 1, 2, 3, 4, 5. Relax. Very slowly and gently focus your attention on knee and till the tip of your toes. Make your toes pointing downwards. Contract your calf muscles. Hold it tight for about 5 seconds. 1, 2, 3, 4, 5. Relax. Very slowly put your awareness and mind on your toes. Feel at the back of your mind that your toes are relaxed. Slowly let the wave of relaxation move upwards. Your ankles are relaxed. Your calf muscles are relaxed. Your knees are relaxed. Your thighs are relaxed. Your buttocks are relaxed. Your lower part of your body from the waist till the tip of toes, lower part of the body is completely relaxed. There is a peripheral vascular changes happening in this. Scientifically, hemodynamic circulation is changing. When there is a stress response, there is a more blood towards the periphery and less blood towards the center. When there is a relaxation response, there is a redistribution of this hemodynamic changes into back to normal. So that can relieve your headache. So your lower abdomen part, your chest part is relaxed, your lower back, middle back, upper back is relaxed, your shoulders, arm, forearm, hands are relaxed, both the sides, your neck muscles are relaxed, your facial muscles are relaxed, your entire head and neck muscles are relaxed. By and by, you notice that the intensity of your headache is actually reduced and you feel at ease. Very slowly and gently, you also notice that your breathing frequency become more regular, more relaxed and refreshing. And with this relaxation, I want you to practice this relaxation whenever you have headache, any type of headache, whatever is intensity. Practice this with your eyes closed and follow this frequently to reduce the intensity of your headache. Preferably, we want you to practice this before bed so that you can also train the subconscious mind to reduce the triggers and to reduce the increase the feeling better period and reduce your headache frequency to a drastic level, and this will help you to change the cognition or cognitive restructuring. It will also help you to fine tune the sensitive mind, stressful mind towards more relaxation. We hope this relaxation technique will be useful for you and you practice this relaxation technique and all of our integrative medical therapies focusing on your headache. For further details, you can contact our doctor from our website and you can see what best therapy is suited for you. Thank you one and all.